Hello everyone. We're starting again with our series of interviews of preeminent plastic surgeons. And today we have Dr. Edwin Zara. He's a plastic surgeon from Venezuela. He's the medical trainer for Renuvion for all Latin America. And he's a aesthetic plastic surgeon dedicated to body contour surgery. And with the experience in Renuvion technology, he became rapidly a reference for all Brazilian plastic surgeons. So first I would like to thank you for being kind, accepting our invitation. Welcome, Dr. Zara.
Thank you.
Okay, I'd like to start saying that we have a WhatsApp group with plastic surgeons from all over Brazil and sharing experience and often asking for your opinion. And then, when was your start with this technology and how did it develop along your practices since then?
Well, first of all, Rodrigo, I want to thank you for the invitation. It's a great honor and pleasure to be here. Well, I started with Renuvion in 2018. To be honest with you, I was seeking for an option to my patients that don't want to have scars, don't want cuts, and also something to help me in liposuction to avoid skin laxity after this procedure. And first, I came across with Renuvion. At the beginning, I didn't know how this technology works, but I get the equipment. I went to USA in Miami, did my training, and I started to work. And from the beginning, I have something very clear. It's very important with any technology, any technique. First is the selection of the patient. And second is the execution of the technique or the implementation of the technology. So I started to have several cases, and I started to have good results. Maybe have some lucky, I don't know, but I started to have good cases. And the company, contact me and told me that, well, you have good results, and we are seeking for a trainer in Latin America. And I don't know if you are interested, and of course I was interested, and well, that's how my journey began.
Okay, well, I would like to talk about technical topics in a while, but first I'd like to know what kind of patients are eligible for the surgery and how did it change over the time?
Well, the first thing that surgeons and patients need to know is Renuvion is not something that is going to replace an abdominoplasty. Okay, for me, in the present time, for me, it's an alternative, and that's how I present this procedure to the patients. Patients that came to me don't want scars. For any reason, they don't want to have scars, maybe because there are patients that are afraid to have a scar, they have bad experience, or maybe they want something more quick than abdominoplasty. So the first thing is to be clear with the patient. We are not going to replace an abdominoplasty. If you are a candidate for abdominoplasty and you want to choose an alternative procedure, that's okay. But this is not going to replace an abdominoplasty. That's the first thing. Of course, there are several. I have a classification, and I have patients type 1. These kind of patients are patients that are eligible for liposuction. But in my experience, these patients type 1, they can develop some middle degree of skin laxity after liposuction. So in my opinion, in my experience, in those patients, I suggest to use Renuvion to try to have the best result possible. They are not candidate for abdominoplasty or mini abdominoplasty, or any type of skin resection procedure, but for sure you're going to have some skin laxity after the liposuction procedure. That's type 1. The type 2 is a patient that have good muscle. There are not any kind of muscle diastasis, have some moderate degree of skin laxity. Maybe they are good patients for mini tummy tuck or reverse skin resection of the abdomen, not reverse abdominoplasty. It's very different. So in these patients, you can do both things. You can avoid to perform the mini tummy tuck, okay, or you can combine. You can do a skin resection without undermining, okay, just take a block of skin and tissues, and you can use Renuvion in the rest of the abdomen, okay? And type 3, there are patients that for sure have to maybe go for abdominoplasty. The diastasis, it can be no more than 3 centimeters. If they have a diastasis more than 3 centimeters, you have to open. You have to lift the abdominal flap and you have to repair that separation. But if the patient has, in my clinical examination, in ultrasound examination, no more than 3 centimeters, so we can go for a liposuction, and Renuvion and has an alternative for abdominoplasty. So you have 3 scenarios, and you have to select your patient, and you have to explain what can expect from each scenario.
Okay, do you eliminate the mini tum tuck for your practice?
To be honest, I think in this moment around 95% of my patients that are eligible for mini tummy tuck, I don't do anymore. Not because I don't believe in that procedure. It's because you have to understand that in these almost 3 years, I became something like a reference, and patients come to me because they say, oh, this is the guy that is not going to cut me, he's not going to make a scar. So they sometimes I have patients that went to 2 or 3 surgeons, and the first thing that I say, you know what, these 3 guys have reason. They told this 3 guy told you the truth. You need an experienced resection procedure. But the difference is you are not seeking that. You want a procedure without any skin resection, without scar. So I can give you that if you understand what is going to be the outcome. So I think that's the key point. To try to be different, but you have to be honest, and you have to say this is what you can get, because the patients sometimes have high expectations, and maybe the results can be very, very good. But if the expectations are higher and they are not equal to the results, so of course nobody's going to be happy with that.
Okay, I think it's very important to be honest with the patients, because with the rise of this technology, we see patients coming for us, asking for a surgery without scars and expecting exactly the same outcome, or they expect to do the liposuction with Renuvion, and they want to have the same result as they done an abdominoplasty. And we see sometimes surgeons, not the surgeons, but people maybe trying to sell this. So this is the substitute for an abdominoplasty, and that's not true.
Yes, well, Rodrigo, you need to understand that all the technologies have some marketing, and behind. So in the case of Renuvion, the curious is the marketing began with the own doctors. It was not the company. the own doctors started posting these amazing results in not only in US, in all Latin America. The first Latin American country that began to use Renuvion was Colombia, and they started to post an amazing results. And to be honest, I knew about Renuvion because I follow many of these Colombian surgeons, and I have many patients that came to me and tell me, you know what, doctor, do you have J plasma? In that time, this equipment was called J plasma, and I don't have it. So that's one of the things that I start to seek for this. But about the marketing, it's very important that everybody's going to post good results. Everybody's going to say that this works for everybody. But I think in the end, that is very important is when the patient crosses the door of your office and sit in front of you, you have to tell the truth, tell the reality, say, okay, let's see, what do you want? Let's go for the examination, and I'm going to tell you if it's possible to do it. I think the most difficult part of use Renuvion is to try to start your first cases, your first, 20, 30 or 40 cases, because you don't have any background. You have just to tell the patients, okay, I have this case from this doctor, and this is what this device can do. The patient is going to tell you, okay, doctor, but you can achieve that result. And I think that's the fear that many surgeons has, with this technology, because sometimes the patient is going to tell you if it's possible to achieve those results. And of course, this technology works. It's a great technology. In my case, changed my practice. In Venezuela, I was the first surgeon that started to use it. So in the beginning, it was tough because many patients came to me and say, I know you do Renuvion, I want to do Renuvion. And I don't know, my first, 20 or 30 cases, I do it to everybody, to be honest. Every patient that crosses to my office, I do it. And the thing was this, I told the patient, okay, this is a new technology. I start to use it. You want to try it. I want to see how much or how far I can go with this. And my only commitment, the only commitment is this. If in 6 months you don't have the results that you want, my commitment is we can go to the OR. You are gonna pay the clinic or the OR fee, and I'm not gonna charge you anything for my fees. Okay? Maybe some surgeons that hear this say, okay, I cannot do this. I do it. At the present, I still do it with every single patient. I talk to the patient, I show my results, I say how far we can get, but in the end, the last phrase that I always told my patient is, if you are not happy with the results in 6 months, we can go to the OR, because this is a commitment, 50% by you and 50% by me, because you don't want the scars. Okay, so you are choosing an alternative procedure, and I am expected to do it. So this is like a contract. So fortunately, in 150 cases, I only have to do a reoperation one patient.
Well, that's a very honest approach to the patients. But what should the patient expect? The true expectations they should have about the results? Do you tell them how much of the skin laxity will be resolved, or how do you manage that?
Okay. Well, the company says that you're going to have a 60% of skin retraction. That's what the company says. In my experience, you're going to have, in some cases, around 80 to 90% of skin retraction. In other cases, you're going to have around 60. But in other patients, you maybe going to be in 50 or maybe 40%. Okay. And so I told my patient this example. Imagine that you can disattach or you can pull the skin from your body around 5 centimeters. Okay? If you improve 60%, the 60% of 5 centimeters is 3 centimeters. So if you improve 60%, you're going to pull your skin only 2 centimeters. So you are going to be happy with that, or your thing is not enough, or you want something else. If the patient says, you know what, I think that's good, I'm going to be happy with that, I do the surgery. If the patient said, I think I want more, I think it's clearer, so we have to do a tummy tuck or abdominoplasty. That's simple. Because remember, if the patient have a normal expectation, you're going to have good outcomes or good results. No, basically from the surgery, because we all know, all surgeons knows that what really matters in the end is the patient opinion. If the patient is happy, if the patient said, doctor, I feel happy, I think this result is amazing, it doesn't matter even what you think, okay? Because sometimes, and this, Rodrigo, sometimes we say, I don't like too much this result, but what really matters in the end is the patient is happy. If the patient is happy, nobody's going to have problems.
Of course, if it works for the patient, that's the goal of the surgery. Yeah. So, well, I think the results depends of the each case of each kind of patient has a different result. So, do you think there's some kind of patient that the technique doesn't work, and do you think there's difference between the skin retraction between maybe the abdominal skin, the back skin? Do you see something like this?
That's a very interesting question. Let's start for the gender. First of all, males, just for hormone and other factors, the skin retraction is better than women's. Okay, but we all know that, at least in my practice, the 99% of the patients are women. So I'm gonna talk more about women. So that's about gender. About age, of course, from 18 years old to 50 years old, I think that's my range of treatment. Okay, I don't say that if you have 55, I'm going to do Renuvion. But above 60 years old, I think it's not going to be good results. So in my case, around the 90% of the population of my patients are between the 30s and the 50 years old. In that range is the 90% of my patients. Okay. What about if the patient is primary cases or secondary cases? Of course, is a primary cases. The result is going to be a lot better because than is secondary, and the reason is this. One of the things that we have to understand is this technology needs collagen to work. And to explain this to surgeons or even the patients, I always say that under the skin we have like a spider web, and that spider web is the fiber center network that basically is a collagen matrix, and so if we have fiber center network that is intact, that that patient doesn't have any kind of surgeries or even aesthetical treatment like, I don't know, sculpting or anything of that. So if we have that fiber center network intact, for sure Renuvion is going to add better in that matrix. But if we have a secondary cases with fibrosis, maybe it's not going to be so effective. But I have some cases with patients with fibrosis, and the result is amazing, and even amazed myself, to be honest. And sometimes I question myself: is luck or is the device? I don't know, but for sure you're going to have better results in primary cases than in secondary cases. For surgeons, it's very important to understand that you have to change the way that you perform the liposuction. And why is this? Because your main goal is to preserve this fiber center network. So you have to use less traumatic cannula. When I start to perform Renuvion, I use the 5mm basket or Baker basket cannula, or Flair Mercedes. And now I use only 4mm Mercedes cannula for everything, okay? And also, and we can talk about this later, and also if you can combine Renuvion with a technology that helps you to preserve this fiber center network as ultrasound assisted devices or power assisted devices, I think the result is going to be better. Of course, you have to understand how this technology works, how to combine it, and what is the goal to use it in conjunction.
Okay, do you think the thickness of the skin or the dermis is an issue? When we compare the thickness of the dorsum and the thickness of maybe an abdominal skin or an arm skin, do you think there are different results?
Yeah, we for sure the marketing or the results are focused or centered in the abdomen. But we can use Renuvion, and this, in the neck, in the back, in the abdomen, in the arms, and in the thighs. I think, in my experience, the best retraction that you can have is in the neck and in the arms. For sure, you're gonna have the best skin retraction there because it's it's not too thick, so it's not too heavy, so it's more easy to to attach or reattach to the skin when you contract this fiber center network. The third, to be honest, in my experience, is the back. We all know that the back responds very well to the skin retraction or skin contraction. The fourth is the abdomen, and I think that the most difficult is the thighs. The inner thighs or the whole thigh is very difficult to treat when you have skin lax. When I perform this procedure, I do a full body contouring. I always treat the arms, the back, and the abdomen and the thighs. So I can tell you with a very, very clear opinion about this that you're gonna have more retraction in the neck and in the arms than in the back and in the abdomen. But we always focus, the marketing in the abdomen because it's basically what patients want to see. But we cannot forget that we can treat other areas.
Okay. Regarding abdominoplasty, do you think it's safe to use the plasma in the abdominal flap?
Okay. Before I answer that question, I want to say first that I am not against abdominoplasty. I even perform more abdominoplasty than in the past because, it came to me more patients that want to do Renuvion, but, some of these patients are not candidates, so we have to do abdominoplasty. The second is you can combine, for sure, some skin resections with Renuvion, like the mini tummy tuck with Renuvion, or an axillary brachioplasty with Renuvion, or even you can do a platysmoplasty with Renuvion. Okay, we cannot just say, okay, if I have to open or I have to cut some skin, I cannot do Renuvion. No, you can, do Renuvion and also, just take out some of the skin with this procedure that I already mentioned. But one of the things that you need to be clear is this. These ligaments, these collagen fibers, this fiber septal network goes from the muscular fascia across the scarpa fascia and up to the dermis. It's a connection, okay? And we have two almost fat compartments, the deep or the subscarpal compartment and the superior or suprascarpal compartment. And why I explain you this? Because when you do abdominoplasty, you disattach the deep compartment, okay? Basically, this fascia scarpa from the fascia, the muscular fascias, right? So with that in mind, if you rise the flap and you think that you can, or you want more skin contraction from the scarpa fascia to the dermis, yes, you can pass Renuvion there. I don't think it's gonna affect the vascularization, I don't think you're gonna have problem, but if you, I'm telling you in theoretical matters, but if you ask me for my personal opinion, it doesn't make sense to do it. Why is that? Because I always do, the only reason, in my opinion, to do Renuvion is if I don't going to leave all the floor and if I don't going to leave any flap, or if I'm going to leave just a tiny portion to resect it, and I'm going to pass Renuvion in the rest of the flap. And when I say flat, I mean about every part of the body. But if you already, rise all the flap, in this case, abdominoplasty, if you rise all the flap, so you disattach the whole flap from the fascia. So and you already maybe suction the flap, and I don't know why to pass Renuvion. For me, it doesn't make sense because you're already going to take out the excess of the skin, and the healing is going to make a contraction of the flap to the body. So in my case, it doesn't make too much sense to do it.
Okay, I will just the way we perform the abdominoplasty is basically or mostly lipoabdominoplasty. So in this kind of technique, we don't undermine too much the flap, except the center of the abdomen. So we keep the fibroseptal network almost in all the abdomen, and just undermine the place where we have to make to correct the diastasis. So in this kind of surgery, when we don't undermine too much, do you think it would be good to do that? I tell you why. Sometimes we have patients that have, I call, vertical excess of skin, but sometimes they have also horizontal excess of the skin. If we could almost do a vertical scar. So do you think it would be, we have any kind of advantage to do to associate the Renuvion in these cases?
Yeah, that's going to be my second commentary, because We all know that in Brazil, all of you follow, what is the Saldanha technique, just a very tiny central tunnel for the application, and the rest is just everything attached to the abdominal wall. So maybe in that technique and Tulua abdominoplasty, that is not any undermining of the flap from above the umbilical. In those two techniques, I think you can use Renuvion very safely, and more important than safely, more effective. I think it's going to be effective because you always have to keep in mind, a surgeon that uses Renuvion have to keep in mind two things, in my opinion. First, preserve the fiber septum network. Always. You have to keep in mind that you are preserving the fiber septum network. If you don't preserve, if you disrupt this, you make a disruption, or you destroy it, or you disattach it, for sure it's not going to be effective treatment. And the fault is going to be you because you don't prepare your ground for the use of Renuvion. So I think you have to keep in mind that. And the other thing is, it's very important that when you use Renuvion, remember that Renuvion is heat, okay? And with this heat, we're going to heating the tissue, basically, because we want to contract the collagen fiber, but also, and this is very important, and many surgeons forget this, it's not just the instant contraction by the heat, it's also the stimulation of the neoplastogenesis. We are going to stimulate the formation of new collagen, and this new collagen is going to increase the density of the collagen, and it's going to make the fiber more thick and more strong, and that is going to make that this result last more over time.
Okay. Regarding the fibroseptal network, do you think is there any difference between the strokes being performed deep or superficial on the flap?
Okay, yes and no, and the reason is this. In my experience, to be honest, maybe the 90 or 95% of my cases, I always in the deep plane, above the scarpa fascia, okay? Because as you know, the first step of a liposuction is to depolp all the deep fat compartment. We extract all the fat from the deep fat compartment. And if you're going to perform an HD lipo, or if we believe that the flap is too thick, we're going above, from the superficial compartment. In my case, I always, empty the deep fat compartment. I get the thickness of my flap that I deserve, that I desire to leave. So, in my case, I always be in the deep or maybe an intermediate plane. I don't know, but go superficial. It is not too important in my opinion, because you are not treating the dermis, so you don't have to go under the dermis. Okay. The most important attachment is from the scarpa fascia to the muscular fascia. Okay, so I think that's the key plane. But if you, in your liposuction, create two spaces, superficial and deep, for sure you can go in both planes, and you are going to distribute the number of passes in those planes. Okay. But if you have the need to go there, but it's not like something you have to do in each case. You have to open a space in a superficial plane and pass Renuvion. In my opinion, it's not necessary. You just go for the plane that you create in your liposuction.
Do you think when we go superficial, if you can damage the superficial subdermal vascular network? Of course, we don't want to do that, but do you think the plasma could damage it?
Well, yes or no, because if you go parallel to the tissues, you know, the way that this energy works and the way that we use it is almost impossible to, you know, damage the subdermal vascular plexus or even to create a burn. Of course, this is key. And if you don't do a proper technique, if you have altered, other factors like it's a secondary cases, it's a patient with too much fibrosis, and you have to perform too much traumatic liposuction to try to release all the fibrosis. The patient is a smoker, and those factors, of course, is a high probability if you go superficial that you can create an ischemic lesion and to create a burn there. But for me, it's many factors. You know, it's not just Renuvion that is going to create a complication. You know, there are several factors that have to be involved to have a complication. So try just to be in the plane that you are performing the liposuction. If you create a superficial space, just pass Renuvion there too. It's not going to be any problem. Just remember, you are not treating the skin. That's very important to keep in mind because I have seen some doctors in some videos that go, you know, in this direction against the skin, you know, in a tending fashion movement, you know, like this. Like the point of the handpiece goes straight to the skin, and in that case, for sure, you're going to have a high probability to have a burn.
Well, we have a lot of patients here that seek for a better result in the back, especially the patients with a secondary liposuction, and we know the struggle to give them a good result. Do you have any kind of tip? How do you manage that to get a better result? Or we just try the normal technique and see what happens?
Well, first of all, in the back, in my opinion, you have to take out almost all the fat that you can. You have to leave it almost empty, you know, because the bag is already too heavy. So if the patient has some really like back rolls and, you know, with a lot of fat there and also some fibrous tissue from the primary case, the first thing that you have to do is to try to take out how much fat you can. You know, I always take out how much fat I can from the back, you know, take out how much fat. Always trying not to be so traumatic, you know, you have to take your time. You know, in secondary cases, I always use, I know in Brazil it's not allowed this moment, but I use Baser, you know. For me, it's a great tool for secondary cases because it's going to allow you to enter in those spaces without being so traumatic, you know. And when I mean traumatic, it's not just for blood loss, you know, it's just for tissue destruction. So you can preserve more this fiber second network, and you can extract more fat more easy, preserving more collagen fibers attached to the body, and that in the end is going to be Renuvion is going to treat. If you destroy everything, you can use Renuvion and it's not going to work. Okay, so in my opinion, try to be the less traumatic possible in secondary cases, in this case in the back, and try to take out how much fat you can, okay, to try to take the heaviness. of the back. And in the back, I always cross the passes. As you know, the maximum passes are 6. So in my case, I try to cross it. From different portals, I try to cross it. But in the end, has to be 6 in total. Okay, and that's basically is very important. There are some doctors that says that they do how much passes as they feel the skin is retract. I think it's a little bit dangerous to do that, because for sure it's going to work in many patients. That if one patient you maybe don't have the feeling in your hand, and maybe you do too much energy and the tissues absorb that energy, meaning heat, maybe you can have some problems there. Maybe you can have some burns. So, in my case, I always have been in 6 passes. I think it's more important the velocity, in the back, because it's more thick. I go slower, I go slower, I take my time, and I leave that the heat, that the tissue absorbs some heat, but I always do for 6 passes. I think that's more safe, that's more systematic, than just do how much passes, how you think or you feel is necessary to contract the skin.
And about the speed of the strokes, how do you do that? Like 1 centimeter per second, like that?
Yeah, we can talk about that. But you and me know that we don't have like a velocimeter in the OR. We don't have that. I think it could be a very cool feature, to have it in the handpiece, to tell you the speed that you need to go, something that measures how quickly or slower are you doing, I hope if they hear me, they can do it, because I think that's very important. To be honest, it's something that you get over time, in the beginning, you're going to start to do them too slowly, then you're going to start to do it more quickly. But, in the end, you're going to see, maybe this is not too scientific, but trying to see the tissue when you pass Renuvion, trying to see the skin, because the tissue is gonna talk to you. You're gonna see how there's gonna be some skin retraction when you do your strokes. And trying to do not too much, not too fast, not too slow, just to be in the middle. But the end is something that you're gonna get, and in the courses, in the training courses, that's what I focus, it's one of the things that I always focus, and to tell them, just grab the handpiece, start to do the stroke, and I always say, go faster or go slower, because in the end, it's something that you're gonna feel, it's not something that you can measure, to be honest, and it's a very key. For me, it's a critical point in the technique. Because I teach this the use of this device. To be honest, I think I have like 99% of the technique covered, how to teach it, but the only 1% weak spot is the velocity. To be honest. Because it's something that you have to feel, and you say, okay, I see, this is the velocity that I have to go, to be honest.
Okay, well, we're almost ending our interview, but I'd like to know, what do you see for the future? Do you think this kind of technology or any other kind of energy will have to be used for every time we perform a liposuction, or do you think it will be reserved to some kind of patients, and there's still space for the regular liposuction?
Well, in my opinion, traditional liposuction is something that you have to learn properly. Okay, you need to learn a proper liposuction technique. Okay, because technology just is going to enhance and is going to help you to obtain better result that you already are having. You already are obtaining. Because if you go for the technologies, believing that you're going to have good result because you are having bad results, for sure what you're going to get is troubles. Okay, so in my opinion, first we have to have a proper liposuction technique. Okay, and we have to start by basics technologies. For me, the first, to be honest, is the power assisted liposuction. The PAL. The power assisted liposuction is the first technique and technology that we have to to start to use in our practice, because it's going to make the liposuction better with less irregularity, and also it's going to take care of your shoulder, and your elbow is going to be grateful to you either. Second, the UAL, the ultrasound assisted liposuction. Of course, you can use in primary cases, but I think the two indications for me, to be honest, you tell me, okay, what is the indication for ultrasound assisted liposuction? Is mega liposuction, if you do it, okay, if you extract 6, 7, 8 liters, for sure you have to use something of this because of the reducing the blood loss, and the secondary cases with fibrosis. Okay, to try to enter in a frozen abdomen, basically with fibrosis, with a regular cannula, my friend, you are very hard, to be honest. You need to use a finesse technique and a proper device to enter there. And for me, in my case, Pacer is the guy to use to be there. And in the end, is the skin contraction or the tissue contraction technologies like Renuvion, that you need to understand how it works, how to select your patients, how to use it. And I see the traditional technique is not going to disappear because they are surviving over time, And I think technology is just going to help you to obtain better results and offer alternative to your patients. Okay, so you cannot abandon the traditional techniques, and you cannot be close to the present technologies and the future, because for sure this kind of technology is going to evolve over time. It's going to be better and better over time. These kind of companies, they are always analyze all the data, and they're trying to do just things more better. And I think we're going to see over years, we're going to see a tremendous development in this field.
Well, it was awesome being talking to you. I'm sure our audience is very happy. I'd like to thank you again, and also invite you, when you come to Brazil, to visit us. Maybe visit us at Blanc Hospital, São Paulo, maybe for a lecture, or maybe also just to drink a cup of coffee. But I would be very happy to have you with us.
Well, Rodrigo, once again, I want to thank you. It was a real pleasure and honor to talk to you. I went to Brazil. We made some courses there. All of you guys are amazing. I was very happy. And, for sure, we can drink a coffee, we can do lectures, and for sure we can make a course in Blanc Hospital. So come with me.
Okay, thank you very much. Muchas gracias.
Obrigado.
Bye bye.